I'll start with Dr. Antoine Keller. Dr. Keller, tell us a little bit about yourself. Who are you, what you do, and why do you do what you do?
Well, thank you very much for having me, Mayor Broome. And I'm a cardiothoracic surgeon, which means that I do open heart surgery on people every day, heart valve replacements and bypass operations. And it may be strange that a cardiothoracic surgeon would be involved in public health, but I think we have an obligation to protect our community and to inform our community, because cardiovascular health is a public relations issue. It's a public health issue. And so as a cardiothoracic surgeon, I think it's important to help educate people. Obviously, you have a huge interest in educating the public, especially on cardiovascular problems, because they're so prominent in our community. Lauren and Jared and the people who work with Healthy BR really do a very good job with that. So I'm a cardiac surgeon. It's a public health issue, and I'm very, very passionate about helping people in our community.
Thank you. Well, let's start with you, Dr. Keller. Are there any chronic diseases or conditions that disproportionately impact minorities? And if so, could you share some examples and details?
Certainly. Well, cardiovascular disease is the most common medical problem in America. And quite naturally, there are significant numbers of people in every community that have cardiovascular disease. And things like COVID-19 pandemic have really brought the importance of pre-existing conditions in cardiovascular disease to the forefront. Things like hypertension, which is 1.5 times as common in African American people as it is in non-African American people, but yet and still African American people have a much lower rate of treatment and of successful treatment of their hypertension. This is a double-edged problem. We have obesity epidemics, which are more common in African American people. Diabetes, twice as common in African Americans as opposed to majority citizens in our community. And peripheral arterial disease, all of these things have a much higher incidence in the African American community and in the non-white Hispanic community as well. And they're things that really do impact everyone's daily life in one way or another. It's really important to have initiatives like your Healthy BR initiative to provide educational resources to people so that they can understand how they can treat this as a wellness issue and not just as something that they have to go to the doctor for. Healthy lifestyles, as in your last segment you talked to Chris Tyson about how there are food deserts or places where people can't get healthy foods to have healthy lifestyles. They don't have parks in their neighborhood where they can get exercise. All of these things are really important, and the only way that we can have an impact is if we have programs like yours that teach people how important these things are to their daily lives. Disparities exist, and everybody knows that disparities exist. What you're going to do about them is the really most important part. And one of the things that COVID has really taught us is that people have access issues. Right. And if they have access issues and then can have the same expectation of a favorable outcome if those access issues don't exist, then perhaps we should focus on helping them obtain access to these vital programs to help with their wellness, as opposed to only focusing on the end result, which is the hypertension or the chronic disease that they have.
You know, you mentioned the access issues, and obviously there are some people who, when we talk about disparities and access, they don't really understand, maybe from the larger community, the impact it has on serving the healthcare needs of individuals.
It's true. You know, we've learned from our friend George Bell at the Capital Area United Way that we have a very high level of poverty in the surrounding parishes of Baton Rouge. And so people may not have the resources to be able to take off an entire day to go to the doctor, or they may not have child care for their kids that are now being homeschooled because of the pandemic, or they may not have insurance because they're gig workers and their employers don't pay for their insurance. So all of these things mandate that we have some cultural sensitivity with regard to having an opportunity to go to the doctor. And they're really important issues, and we have to team up to accomplish all of our goals with regard to.
But just share a project that you're connected with that you'd like for folks to know about, or maybe something resourceful that you think would benefit our listeners. Dr. Keller?
Yes, ma'am. We have an initiative that's almost a year old called Heart Sense. And one of the problems that we have in cardiovascular disease is people don't know that they have cardiovascular disease. And for reasons that we alluded to earlier, they may never present to someone who can appropriately diagnose them with cardiovascular disease because of a number of access issues. So we have decided that if the people won't come to the doctor, then we are going to have to take the doctors to the people. And so we are doing murmur screenings for people wherever they are, churches, businesses, pharmacies, places where people congregate, community centers, because if people won't go to the doctor to learn that they have cardiovascular disease, there's new technology that we have access to where we can help direct them on a path to be able to get their heart disease taken care of. For instance, if someone has had a family member who's been told they have a heart murmur, we will go to the community, we will listen to their heart with a digital stethoscope that has artificial intelligence that can diagnose them with certain cardiovascular problems and get them into a system where they can be taken care of. One of the really good things that we do here in Louisiana is give people insurance. And we have a very low rate of uninsurance. It's about 8%, which is remarkable, I think. So it's not because people don't have insurance that they don't go to the doctor so that they can get taken care of. We feel that it is an access issue. So HeartSense is going to be helping to remedy that problem. So if anyone has a question about their cardiovascular fitness and you see our HeartSense flyers around, come and visit us because it could save your life.
Excellent.